So today I would like to shed some light on male sexual dysfunction and how it is very important for young, even old population to come and seek the help for male sexual dysfunction. It is not a taboo, it's an essentiality. So as we know, male sexual dysfunction, the main thing, the condition is called as erectile dysfunction. Erectile dysfunction is the loss of erection in men due to various reasons. Erection requires mainly neuronal, the nerves has to be normal, hormonal, the hormones flow has to be normal, and psychological. In young population, most would be a victim of this taboo and psychologically affected, and it's called a psychological erectile dysfunction, and come to our OPDs for help. And initially they always start with some other complaints and they land up in complaining the erectile dysfunction and so most of these patients doesn't need any major medication or treatment. They just require a simple psychological counseling after ruling out some major causes of erectile dysfunction. Erection happens with good blood flow into the penile vascularity, and till the completion of the act, the blood flow has to be held on. It is to avoid the venous leakage, and once the ejaculation happens, the erection comes down. It's a very simple act, and most common misconception among our young population, and they call themselves erectile dysfunction, is the time duration. The time duration, everything considers according to medically, it is at least a minute of erection post ejaculation. It might come down, and if it is not less than that, it's called erectile dysfunction. So normal attainable time for erections to land and perform the sexual intercourse is about a minute. If it is less than a minute or less than 30 seconds, then it's called premature ejaculation, and it is not called as erectile dysfunction. The only criteria where you can cause erectile dysfunction is in patients whom there is absolutely no erections. And very important thing to notice in these kind of population is to observe early morning erections. If there is early morning erections, then will not have any erectile dysfunctions. In middle age group from 30 to 50, I would like to highlight one point. They will be actually coming with an organic erectile dysfunction, which has been increasingly common nowadays, and most noticeably, this is the first indicator of a serious underlying cardiovascular dysfunction. So people, when they come in 30 to 40 age groups, we are trying to search for the major reasons, trying to do overall lipid profile, check his heart conditions and other endothelial stability to rule out any possible heart issues or myocardial infarction, which is commonly called as heart attack. So which can be easily prevented with few medications. And nowadays there are a lot of improving technicality, and the treatment is becoming more and more simpler. Even with complete erectile dysfunction, even in old age, more than 50 years population or 60 years population, we are able to treat them with penile processes. As the technology improves, now as the days pass, it's becoming more and more cheaper. There are various kinds of processes like semi-rigid, inflatable, 2-piece, 3-piece, and all the things we are offering in Apollo. And we are trying to create a one-stop center for all erectile dysfunction and male sexual dysfunction. Maybe it's an erectile dysfunction or early ejaculation or Peyronie's disease, where there is a band of a plaque on the penis. We are having a lot of technology involved, and surgeries have been made easy as a day care, and we are treating them. Most of the patients improve with simple medications, which is called as PDE5 inhibitors, which we often give and check the compatibility. If they are working, we will advise them to take only a psychological counseling. So with this, I would like to conclude, there is no need to find any hazards or any kind of misconceptions regarding erectile dysfunction. It has become a basic necessity of the normal human beings. Irrespective of the age, we are able to treat all the patients equally, and provide them with utmost care. Thank you.